Hello everyone, welcome to Artemis Mental Health Online. My name is Pallavi Sharma and I'm a consultant counseling psychologist at Artemis Hospital, Delhi. With me, I have Dr. Rahul Chandhok, senior consultant and HOD psychiatry at Artemis Hospitals, Gurgaon and Delhi. He has been practicing in Delhi NCR for 20 plus years. Welcome, Dr. Chandhok.
Thank you, Pallavi. Welcome, viewers.
So, viewers, today's topic of discussion is childhood OCD. So as you progress, we'll take up a particular case. Dr. Chandhok, recently a young boy approached me and he's 11 years of age. And his parents are very worried. They got him to us, wherein their main complaint was since last year. He has been excessively washing his hands, using a lot of sanitizer, avoiding touching doors, books, toys that are not his. He gets very concerned about his own health or others' health, particularly his family members. He has so much difficulty in going to school, interacting with his schoolmates, sitting in his class, or going outside and playing with his friends in the park. He doesn't want to go to any other house except his own house. And he wants his parents to be, around him. And he also wants them to do the same activities like washing their hands, cleaning services, cleaning properly every inch and corner of the house. And due to these concerns, his parents showed him to a general physician who has recommended them to meet a psychiatrist and a psychologist. So, sir, I would like to know what exactly the problem is with this child, what difficulty he's facing.
So, you see, what we call this problem is OCD.
Indeed.
So, OCD is a kind of disorder where persons, as you have a slide of this case, we put
Right.
it on. So, as viewers can see in the slide, that
Right.
the child keeps on doing things repeatedly, and the child is scared. The child feels that if he is not going to do these things repeatedly, something bad is going to happen. So
Right.
OCD is a thought disorder where you get negative thoughts which are repetitive, which are overpowering, and you feel compelled to do certain acts so that your anxiety goes down and you feel comfortable.
Right, sir. And so, how young does OCD emerge? Like, what is the normal age group we can see OCD in?
So mostly we see OCD as children start going out and meeting people on their own, and they get exposed to media and to various things which start clouding their thoughts. Okay, whatever is the narrative or the environment in the homes or school. So mostly it presents to us when they are 7, 8, 9 years old.
Right.
Okay, when they have the capacity to grasp things what are happening in the environment.
So, what do we exactly understand by obsessions? Like when we say obsessive compulsive disorder, what are obsessions per se?
So obsessions, if you as the viewers can see in the slide, they are basically thoughts, but they can also be images or urges or sounds or some songs which keep on coming repeatedly in the child's mind. Okay, they start automatically. They are repetitive in nature.
Right.
They come to the child's mind unwillingly. Okay, and
Right.
child has no control over them, and a lot many times they are negative, which brings up the anxiety. And most of the time the child recognizes that they are baseless, but
Right.
sometimes, especially in children, it becomes difficult because they are very scared of this thing. So they may not be able to recognize that they are baseless, Adults definitely are able to recognize this, but we definitely have cases where recognition of obsessions as a problem is common.
So these are obsessions, sir. And what about compulsions? What do compulsions follow the obsessions? What exactly do we mean by compulsions?
So, whenever a person has obsessions, they provoke anxiety.
Right.
And to decrease the anxiety, the person is compelled to do certain actions. It could be checking, it could be repetitive washing, it could be saying something in his or her mind, or repeating something soothing. So the child is compelled to do these acts, and these acts are called compulsion.
So
Examples which you can see in the slides are like washing hands repetitively, checking things, or asking about stuff again and again, which the parents or the teacher have already answered, like that.
mm. So for children, are there specific kind of obsessions and compulsions that are always seen, or it may vary from child to child?
Usually varies from child, but yes, checking and washing compulsions are the commonest.
Okay. And so every time a compulsion will follow obsession, will it come in that sequence that every time there's an obsession, there will be a compulsion for it?
Not necessarily. We do come across cases where we find pure obsessions also
Mhm.
and pure compulsions also, but majorly they are mixed. Both the things are there, but we do find cases with pure obsession.
Right. So what are the common causes that we see for OCD? Because children are so young and people often feel that, they don't have that many stresses and they should not be worried. So is depression and anxiety a common cause for it, or are there other causes to cause OCD?
So OCD itself is a disorder, so it's different from depression and anxiety. But yes, depression and anxiety can happen secondarily in the child. So if the child is very disturbed because of the repetitive thoughts and the acts which the child has to do, the child faces great anxiety. And because of the anxiety, if the thing persists, if the child is not brought for treatment, then the child may go into depression.
Right.
When we talk about the causes, we have to talk about the biological cause, the uh, psychological cause, and the environmental causes. So you see, like if genetics play a major role in this, then we have neurochemicals, the serotonin, which
Right.
remains decreased in OCD,
Right.
and we have vitamin levels and thyroid, which influence. As the child is growing, the personality is taking shape. Whatever influences the child is exposed to, they definitely matter. And the environment at home, school, and the relationship at home also plays a bearing,
Right.
because the relationship sometimes can be stressful, which is perceived by the child as very disturbing, leads to OCD. Like in COVID, it happened that the child would keep on hearing about COVID, washing hands, and keeping the dirt away, not meeting people, not touching things. So
Right.
a lot of children suffered from OCD.
Right. 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 So is it a proper predictor that if, let's say, a family member or a parent has OCD, the chances of a child or a sibling having OCD increases? Can you predict that? Can we see
Yes,
that?
yes, but it is not certain that yes, the child will definitely have OCD, but yes, the chances definitely go up.
Do- So a lot of times, like even over there in this case, the child was encouraging and wanting the family to participate in the cleanliness process. So a lot of time people get confused that, if the relief, if the distress is being caused to a particular person, what kind of relief will they achieve if someone else is doing it? So how do we understand that, sir?
So if the family also starts participating in the ritual, uh, thinking that this will suit the child or the child would feel comfortable, because this happens because they are not aware about OCD.
Right.
It is a very hidden disorder. People don't talk about it much. And because of that, people think that yes, whatever the child is saying, if we do that, the child may become comfortable and stop asking again. But it is the opposite happens, that the child will again ask to do them the same ritual.
Right. So sometimes, people think that we're helping the child, that, the child will not get so much distress. We are seeing the child in distress, thinking that it'll soothe them, but it is just increasing the symptoms.
Yes, yes.
So a lot of times, people don't understand the difference between a child having a common routine or an uncommon routine, and they feel it's a part of their growing up, and they're establishing their own routines per se as they grow up. So how different is it, or is it the same
So you have to understand, definitely the OCD child would have a different kind of routine.
thing? Right.
Things change. Okay. Their sleeping pattern might get affected. They might become more irritable. They might become more disturbing to others.
Mm.
Uh, they might become more cranky. So, but the whole thing is that whether the parents are aware of it or not.
Right. Very true.
So if they're aware of that such a disorder is also there,
Mhm.
okay, then they can seek help early,
Right.
helping the child also. But sometimes it just goes on, and there is a huge gap between the presentation of the illness and the first time you meet a doctor for the treatment.
So is it necessary that any child experiencing any amount of stresses or any family history or any other difficulty, the first thing, the first symptoms that may emerge would be of OCD, or will it be some other disorder? It can be of some other disorder as
It could be anything,
well.
not necessarily OCD. Okay,
Mhm.
because uh, see, these kind of disorders happen because of a fluctuation in the neurotransmitter levels in the brain. So the presentation could be depression, its presentation could be various forms of anxiety and OCD.
Right. So how long should parents wait to see and observe these changes so that they can bring the child to a doctor, to a psychiatrist and a psychologist?
So whenever they see that a child is exhibiting behaviors which were not normal earlier, and
Right.
they are not going away,
Right.
they are persisting.
Right.
Okay, and they have started hampering the daily routine of a child,
Mhm.
they should
Right.
seek out help.
Right.
Most of the time, if they seek out help early enough, we are able to handle the cases with counseling. And first preference is for counseling in children when we try to manage, so we are able to avoid medicine. But if the distress is too high, if the child is already into depression, we have to consider medication.
That's right. So often, people want to know about the diagnosis, that how do we diagnose OCD? What is the way to diagnose it?
So you have to understand that, and as I said, anything out of ordinary in the routine or in their behaviors should alarm them. Okay, and uh, if they see that there is a repetitive pattern in the behavior emerging, that should
Right.
alarm them for OCD. So it is like that. Yes, even if they don't understand everything uh, that is happening, at least they should seek out help to understand it. It is
Right.
not that if they approach and it will if it doesn't turn out to be OCD, still they will be captured or some treatment started. It is not going to be that.
Mhm. So, sir, we have assessments and we have some certain scales and interviews for discussions that can be done for um, psychiatrists and psychologists to understand what kind of difficulty the child is facing.
Yeah, so psychological assessments are definitely of great help in both understanding and documenting the severity of the illness. So, YBOX checklist is a great tool for that. Okay,
Right.
and we use Vibox for uh, children Vibox to mark the severity of it.
Right. So, are there any other disorders or any difficulties that can be seen with OCD?
Usually, see, if OCD is not handled properly and in time, usually the child goes into depression, which is common. But yes, sometimes we come across tics also, or trichotillomania, where the child is pulling hair out.
Hanji. So, you're mentioning about trichotillomania as well. That's the last part we did.
Yeah,
Hanji.
yes. So trichotillomania is a kind of disorder which is being found commonly with OCD, where the children pull their hairs and sometimes swallow them.
Hmm. That's right. That's right. So we understand that there are other presentations, other things that might be accompanying it. And so often people would like to know that how the treatment is done. So one aspect that, like you mentioned, is assessment, and then medication plays a role in it, sir.
So because there is a so the treatment of OCD basically involves two things primarily, especially in children. One is the medication part, other is the counseling part, or the CBT as we call it
Right.
technically. So because OCD is a thought disorder, we
Mhm.
try to target and train the children into identifying those thoughts and how to deal with it. Okay, we want them to understand that it is they have. Yeah.
Yes. So you was highlighting the importance of cognitive behavior therapy and exposure response therapy. And we use more of which therapy with children?
So we have to understand that since OCD is a thought disorder, okay,
Right.
we target training the children into identifying such thoughts and learn to ignore them rather than reacting to it. And whenever we have more of compulsions, then we try to train them into how they can avoid the distress. Okay,
Right.
they are given an exposure to the thing they are afraid of, and a response is prevented, which is basically ERP. And they are trained that to see, observe that the anxiety gradually goes down. So these sort of therapies are done.
Right. So what role does medication play if once therapy is done? Does it go hand in hand with the therapies?
So medicine in children is considered whenever the distress is very high and or the child is depressed, so as to provide a quick relief to the children. Because you see, uh, the core concept of why OCD happens is because there is a low serotonin state. Okay,
Right.
but the decision to use medication is taken very judiciously, and we always try to use more of psychotherapy and counseling in case of childhood OCD.
Right. Mhm. So is it always possible, or does it happen sometimes that children don't understand what's happening to them, and when that is when they're not willing to take part in therapy process? So there's no the insight is not present. So then we have to give medication to them.
Yeah, as I mentioned, if the distress is very high or if the child is not cooperative during therapy, there's no option left. Because
Right.
if we don't treat such cases, it is likely to persist, leading to depression.
Right. So does it happen so in adults as well? Like for example, if we see OCD in children when they're younger, does it continue to when they are adults as well? Does it start emerging again as adults and it gets worsened?
See, it all depends. If the child has good insight, they may get rid of it, but it can definitely reoccur later. Okay, and sometimes what happens is you treat OCD with a particular set of symptoms or the particular set of obsessions, and it re-emerges later with another form, and the child is not able to recognize
Mm.
that it is the same illness re-emerging. It all
Yes.
depends how much stress the child is exposed to.
Right. So after treatments or management of OCD, how would you recommend for this process of management of OCD in children in particular?
So usually we prefer that even if the medicine has been used, the child should remain in therapy for a prolonged period of time as they get very comfortable with the psychologist or the therapist, and they are able to express easily whatever is troubling them. So even if when we wean off them from the medication, we prefer that the therapy should continue.
Okay. Right. So, what are the common warning signs that parents should be aware about regarding OCD? What should they look out for?
So they should look out for anything which is happening other than the routine of the child.
Right.
Okay. Uh, Even if the child becomes cranky, the child should be able to come back to the normal self. Okay. Even if the child stays awake for a night or half a night, so the child should be able to sleep the next day. But if the pattern persists, if you keep on watching that, yes, the child keeps on washing hands, and it has been 2 weeks or so, then you must consult. You can either consult your pediatrician or your psychiatrist or your counselor.
So, what are the guidelines or what are the suggestions for parents who have a child with OCD?
That, see, parents are the first person who will keep on observing their child closely. Okay, so they have to be aware of the things which might happen to their child, and secondly, if they see any behavior which is out of ordinary, they should at least try to seek out help from doctors or the medical and mental health professionals to
Right.
understand the child's behavior. So, because so that it may not become a disorder which has to be treated.
Right. So, what should they convey to the teachers and school staff? That what kind of supports that can be given to the child in case
So,
of
teachers
the
play a
family?
great role because whatever the parents miss, the teachers might be able to stop that. If the child suddenly wants to go to the washroom multiple number of times, even and when the such behavior was not observed earlier, they should get alarmed because of it, and they should have a discussion with the child what leads to it.
Mhm.
Okay, and if they see that the hands are more red, they are chipped, or they are not normal, then definitely it should alarm them to the OCD. If the child keeps on asking questions which have been answered, but the questions are such that they are not academic, they basically provoke anxiety,
Right.
then they should be alarmed because of it. So basically, we want that if the level of education regarding OCD is high, definitely we can identify the children earlier and we can help them faster.
Right. So we can say that everyone around the child has a major role to play in understanding the child's difficulties and helping them out to recover from obsessive compulsive disorder. Thank you so much for joining us
Yeah,
today.
definitely. It has to be a team effort with everyone pitching in, from parents to teachers to siblings, uh, in the management of OCD.
That's Thank you so much for joining us today, viewers. Thank you so much, sir, for your guidance and for your helping others understand regarding obsessive compulsive disorders in children. Thank you so much.
Thank you, Pallavi. Thank you, viewers. Goodbye.
Bye.